So since the second section is a little bit different, for regulation, for toxicity, we talk about standard compliance. So it's the research is more about innovation mechanism, and for the especially for the toxicity. So it looks maybe different from the morning section or the earlier section. So I will cover the toxicology for metabolic disease therapeutics. Start with the FDA history. So the Pure Food and Drug Act is the first law enacted in 1906, even before FDA became an independent agency. And then in 1937, a big event happens. It is the elixir sulfonamide story. In this case, sulfonamide is the API, active ingredient. Elixir is more like a formulation. So sulfonamide itself has no issue. It's a powder. When it's in powder format, it's act as antibiotics. The company is kind of mislabeled. They add a solvent called DEG to the powder and then make it become a solution. That causes the issue. More than 100 people die in this case. The picture shows the standard process, how we do regulation in the US. So the Food, Drug, Cosmetic Act, that is the foundation for the FDA, enacted in 1938. The left picture shows the president signed the bill into the law, Franklin Roosevelt in 1938. And then a little bit regulatory background. So in US, the regulation usually laid in 3 different levels. The act I'm talking about, like the 1906, the 1938, served as the highest level, the act or the law. So before the 1938, there's no safety requirement. There's a efficacy requirement. Through the 1938, the safety or the toxicity testing requirements were added. So that is the top level. And then the second level is the CFR level. CFR stands for Code of Federal Regulation. It is at the agency level, like the regulatory agency, FDA or EPA. So the GRB here stands for Good Laboratory Practice. This is really important concept in toxicology. So when we talk about, I know that CRO company here, talk about the CRO channel data quality issue, OECD guideline, OECD GRP, or FDA examination for CRO laboratory. It's all about the GRP or the quality control issue for toxicology. And it's interesting, the FDA or the US has a different system than the EU, which is the OECD GRP system. Since both countries has high level reputation, so people accept both. China is a different situation. China is not an OECD country. So when the toxicology data are generated in China, people raise a question, especially at this stage. When UK separated from other EU countries, there is more question for China-generated data from the Chinese CRO. And then the third level for regulation is the guideline. ICH guideline is the most commonly used one for toxicity testing. We also have FDA, EMA, the regulatory agency for Europe. So this is at the technical or scientific level. Since we all work from different perspectives, like the FDA regulator, the CRO company generated data, they sponsor, they design the study. When there's a commonly used guideline, we can all fall on the same page. For toxicology, the most important guideline is the one I highlighted here, ICH M3R2. It sets the foundation for toxicity testing. Then there are also other they're also important, like the S6 or biotechnology or biologics. The S2 for genotoxicity reproduction is S5A. Carci or carcinogenicity is S1B. In addition, there are other, it's more like a subject matter or specific question, like safety pharmacology, immunogenicity, and the cancer S9. I think it, impurity S7, and the FDA has a internal guideline document for the starting dose for clinical trial after you finish the toxicity study in animal. And then there are also OECD guidelines. OECD guideline is more, the chemical industry or the pesticides use more OECD guideline. But the FDA overlap, like the genotoxicity, FDA has no independent genotoxicity guideline. They use the OECD guideline, like, for example, like the EMS test, OECD 474 is overlap. FDA just cites the OECD guideline in the ICH 3 R2. So that is how they cross with each other. They, I think everyone knows this. The drug development process starts with research and development, and then the phase 1, 2, 3. Also, the regulation, even after the drug was marketed. There are two important checkpoints, the IND submission or approval, and the NDA. I use the terminology for the US, for EU, or for China, maybe a little bit different for the name, but the concept is the same. Then the toxicology study evolved with the drug development stage. So before the IND or for the IND package, the first human toxicology package data usually include pharmacology, safety pharmacology, ADME, or DMPK, single dose, repeat dose. Usually the repeat dose is 28-day or 4-week two-species study, either in rats, dog, or monkey, and genotoxicity. And then once the IND was approved, people start to do the repeat dose. It can be 6 months or start with 3 months served as the preliminary study, and then 6 months or 9 months for the, also for 2 species. The later one, carcinogenicity and reproductive and developmental, these are the later stage toxicity study. This kind of study, toxicity study, use a lot of animal, and they're very expensive. For example, for the carcinogenicity, usually the company do 2-year rat study and a transgenic animal study. One study is about, in the US, is about, I think, $2 to $4 million US. So it's very expensive. People are looking for ways to waive the study if there's a good reason. And for the reproductive, there are 3 different types of study. I write here, FEED, FEED, EFD, PPND. They test at different stage for the embryo development. FEED test fertility and also only embryo. EFD is for embryo and fetus. And then PPND include prenatal and postnatal. So even include, it's more like the fetal stage and the later children development stage. Based on the scope of the symposium and also some feedback from other speakers, I choose the GLP-1 as a case study for my toxicology presentation. So by far, this is updated search. There are non-GLP-1 drug approved by FDA. So it's a very hot area in the drug development industry. And I chose the last 2 or the most recent one, semaglutide and Mounjaro as the example for my case study. So GLP, since I chose the GLP-1, I will give some background or biology information, physiology for GLP-1. It is a polypeptide secreted by the intestine. There's a 31 amino acid. It has a broad effect, including diabetes, weight control, insulin sensitivity, liver blood pressure, heart inflammation, sleep condition. The last one is IDM or DMPK I just mentioned. The half-life for this drug is for this natural hormone is very short. I show here only 2 minutes. So it degrades very quickly by an enzyme called DPP4. So that is in toxicology, this number is very important because when you develop a molecule, you need to decide how often people take the drug. For example, once per week or every day a pill. If it's degraded in 2 minutes, that is too fast. The GLP-1 function. So there are 4 pathways I presented here. The first one is related to pancreas. So there are 2 cell types in the pancreas, alpha and beta. Beta secretes insulin. Alpha secretes glucagon at the bottom. Insulin is at the top. So GLP-1 can increase insulin secretion and inhibit the other hormone, glucagon. Glucagon is a hormone play important role in break down the glycogen in the liver. So it releases glucose to the blood. When GLP blocks this process, it ends up decrease the glucose level in the blood. GLP-1 also acts on the brain. It suppresses the appetite and reduces the food intake. The last pathway is for the GI effect. So under normal situation, we know we eat food. There are carbohydrates in the food. It's turned into glucose through the GI system. GLP-1 can slow down. It's not totally block. It's just slow down by slows gastric empty for this process. So as the end result, through two different pathways, GLP-1 reduces the glucose level in the plasma. GIP is another natural hormone. Because the example I choose to present is a dual target drug. The one is GLP-1, the other one is GIP. So GIP is also polypeptide with 42 amino acid. It's also secreted by the intestine in different region than the GLP-1. I didn't put here for the half-life. It's also very short. GLP-1 is about 2 minutes. GIP is about 5 minutes. So both of them degrade very fast by the enzyme. The GIP function, similar to the GLP-1, it also acts on the pancreas. So it also increases the insulin secretion. Different from the GLP-1, it's increase the glucagon secretion. I just mentioned the GLP-1 decrease, so it's opposite. The appetite effect is very similar. It inhibits food intake and increase body weight loss. GIP also has effect on fat tissue and bone. Now is the case study for the drug called Mounjaro. So Mounjaro is a brand name for the diabetes drug. It's also later was developed as obesity drug. T2D is type 2 diabetes here. The drug was developed by Eli Lilly. I write here is a weekly injection. So although it mimics the effect of GLP-1 and GIP, but they spend quite some effort for the drug design. So it can last for 1 week, the half. The half-life is about 5 days. You can take one injection on a weekly basis by SC, subcutaneous injection. The picture shows is actually a lady from I think it's the phase 3 clinical trial, before and after. So she lost 200 pounds. She was very happy with the clinical trial. So that means the drug is very effective and safe in this case. Now we are getting into some details for the data. So this polypeptides, similar, the molecular weight or the amino acid is comparable to GLP-1 and GIP, 39 amino acid for this drug. And I show the metabolic pathway for the rats and the monkey here, because these two species are used in the standard toxicity study. So the metabolic pathway can be, they have 3 major metabolic pathway and 4 minor metabolic pathway. The deer mice model was heavily used in this drug development. So deer present for dietary-induced obesity. So they usually use the black 6 mice. On week 5, before week 5, they give the normal diet. And then start on week 5, they change the diet to high-fat diet, or obesity basically is induced obesity. So when the mice was about 4 months old or 70 weeks, it is ready for the downstream analysis. The first one is the body weight and food consumption. These are very basic parameters for toxicity testing. So the first panel, there are 4 different groups. The control, a standard control, a reference drug called semaglutide from is used as the reference is from their competitor company, and the Mounjaro, the target drug, developed by Eli Lilly. And there's another group is called fair fat here, a pair fat or pair feeding. Basically, it's pair if the effect, the side effect or the toxicity effect is from the pharmacology effect, or is a second effect from the food consumption reduction. So the effect is quite obvious. The two drugs are comparable also to the food limitation group. They have reduced the food consumption and reduced the body weight loss. For the right panel, you can see the animals start with about 45 to 50 grams. So from this number, you can see it's a diabetes animal, because the normal average animal is about 20 to 25 grams. So when you treat with the drug, they lost your body weight. They also check the cholesterol and the triglyceride level. This study still is a reference drug, but it's a dose a typical study for animal of toxicity, a dose response. So they choose 3 different doses, each with about 3-fold difference, 10, 30, 100 nanomole per kilogram. We can see the Mounjaro is more effective than the reference drug. The same for the triglyceride in the liver. They also check the metabolic rate by treating the deer mice with the reference drug and the target drug. The blue line here is the target drug. It has a higher metabolic rate. they lost a piece of data from the deer mice. So similarly, they dig deeper into the body weight loss. So they separate into different components or composition. So there's a body weight change, fat-free or non-fat, for example, the muscle. So all three components show a very beautiful dose-dependent reduction, and also the target drug is, in this figure, is much more effective than the reference drug. So all this data are collected from the deer mice. In FDA, when we use the animal disease model, we call this type of drug as the pharmacology data or efficacy data. Now I change to the standard toxicity study. As I mentioned earlier, for the ICH guideline or FDA guideline, for toxicity study, you usually need two species, like rats, monkey, dog, both sex, male and female. So this is the standard rats, 6 months, 200 days, is about 6 months. So they also detect the body weight as a basic toxicity endpoint. There's only the Monjaro here. So the drug can decrease the body weight for the healthy animal. The bottom is the monkey, both male and female. The effect, there are some body weight loss, but it's less obvious than the rat. So here you can see why do we need two different species. There is a species difference. The toxicity data summary table. There are other data, but I summarize the animal data here. Start with the genotoxicity micronucleus assay. It is negative, the result. And then the 6 months rat and monkey study. They found the pancreas and the heart, thyroid as a target organ for toxicity. For the safety pharmacology, they detected heart rate increase, but blood pressure increase. So this drug is already approved. We noticed here they detect some side effects, especially in the rodents, in the thyroid. The other effect, like the heart rate, the blood pressure, are more the food consumption and the body weight decrease. It's more kind of expected for this class. Okay, yeah, it's almost over. So it's not a surprise for the pharmacology effect, but for the thyroid, I highlight the cancer study in the rats. They detected the thyroid tumor in all species. They conclude, also, I think I kind of FDA agree with them, it's not relevant to human. So this place, they kind of show the toxicology data interpretation or the weight of evidence approach is used here. They have two species. The thyroid tumor is detected only in the rats, not in the mice. In addition, in the monkey studies, there's no thyroid effect. So they are pretty high confidence to say it is rat specific, not relevant to human. And then the reproductive and developmental toxicity, they detected the body weight change, food consumption decrease, and also repro effect in the female. The male is negative, but the female, the implantation is decreased, the prolonged estrogen cycle, and the malformation detected in the fetus. There's body weight decrease, just like the parental. So there is reproductive and developmental toxicity effect. Okay, so as you can see, there are lots of animal study from both the pharmacology study and the toxicology study. This is what exactly what Econ is doing or what people are talking about today. We want to develop a good drug, but how to reduce the animal use. The Econ is a US agency formed, is also by the law, enacted in 2000, is in charge by NTP or NIHS, is more like a research agency, but FDA and the EPA regulatory agency and other certain federal agencies are heavily involved. Except the science, politics also play a very important role in the alternative method development. For example, when Trump was the president for the last term, EPA proposed a policy to reduce animal by 30% by 2025 and eliminate animal testing by 2035. But later, when Biden became the president, they basically changed the policy. So now FDA is kind of a similar situation. FDA published a roadmap to reduce animal testing in April this year. So their long-term goal is to change the default. Right now, the default is animal testing, like all the toxicity studies, ICH guideline. I'm talking about that is about animal toxicity testing. So after 5 years, they said they want to use NAN as a default. So that is a very kind of aggressive goal compared with the current situation. And for the monoclonal antibody, there's no animal testing by that time. And eventually, they want to apply this policy to all other drugs. So the human cell culture, human relevant cell culture or computational model like the QSAR, this kind of new technology will become the new standard. Similar to FDA, EMA also proposed something recently in October. They talk about the non-human primates, like the monkey I just mentioned for the case study. So you cannot use monkey unless you can prove it is all the other species is not working. And also they mentioned the animal number needed to be limited to the absolute minimum. That I will wrap up. Here, since I'm in the CBA committee WeChat group, I want to thank Angela for the opportunity and thank all the committee members for the symposium. You guys work so diligently, lots of effort to put. I want to thank everyone for your hard work. Thank you.